My name is Charles King with Nightingale College, performing my oxygen administration therapy video. I'm not in uniform, still waiting for my Nightingale College embroidery shirt. Yeah. So I'm going to be giving Jim here some oxygen because he's short of breath. And to do so, when I enter the patient's room, I'm going to shut the door and pull the curtain across for patient privacy. I'll introduce myself to Jim, and then also verify that Jim is Jim, but with two identifiers. Explain to Jim that I plan to put him on some oxygen due to his difficulty of breathing or shortness of breath. And I'll begin by performing hand hygiene. After performing hand hygiene, I'm going to grab my nasal cannula off the back wall where it's placed. Discarding into my biohazard bag. I will place this end of the cannula into my oxygen tree, and then set the flow meter of the oxygen tree to the prescribed rate by the physician. My tree is going to be right here. So with the nasal cannula, I'm going to insert the two tips into the nares so that they're facing backwards with the flow of the nostril. Does he have nares? Yeah, he has nares. Cool. They're small nares, but they're there. And then over the top of the ears, back down and around the chin. Jim likes to take face plants, so we're going to try preventing that today. Down around the bottom of the chin, I'm going to pull the little plastic piece up towards the bottom of his chin so that it fits secure and provides good oxygenation to Jim. As I'm placing the nasal cannula over the ears around the chin, I'm also assessing the skin and make sure there's no breakdown. If there was any breakdown, I'd use some type of padding such as like a 2x2 or a 4x4 and put it around the tubing. Actually, he's got a little breakdown right here. Putting it around the tubing just to help Jim's wounds not be so painful and possibly heal a little. So, like so. But this 2 liters for Jim is enough. So we're gonna give him a non-rebreather mask. So I'm gonna remove, actually, while he's on 2 liters, because 2 liters will help while I'm preparing the other one. So I'm going to dispose of my trash. And then I'm going to get a new mask because this one's dirty. But there happens to be a new one right here that's clean, sterile. And this one does not have. If I needed extension tubing, I would also attach the extension tubing to the wall to ensure that he's gonna have a proper range of motion. So attaching my tubing first to my flow meter, then to my mask. And then I would turn my flow meter up to the new prescribed dosage for the oxygen mask. Oh, what did I do? Is it gonna work? Yes, it'll work, okay. And then while the oxygen is flowing, I would use 2 fingers to place it at the top of the piece so that the bag partially inflates. And with Jim's nasal cannula, we're gonna go ahead and set this for a second. And remove the nasal cannula. Moving on to bigger, better things. Starting at the nose, or the bridge of the nose, ensuring it's secure on the chin as well, making a good seal. We're going to place a green band around the back of Jim's head and then pulling the green bands for a firm and secure fit, and then pinching the metal band in the bridge of the nose so that you have that good secure type, good security and a good seal. And I think this is going to pull Jim down. So we're going to say that, I'm just going to hold Jim's head up for him. Again, with a mask, assessing skin tissue. And noting that if we're at 4 liters or greater, we're also using humidification for the patient, and also checking or assessing skin every 4 hours thereafter for any skin tissue or tissue breakdown, because we don't want Jim's skin to get any worse. We'd like it to get better. But Jim's done with his prescription, so we're going to remove the non-rebreather, turning off the flow, and discarding of his medical equipment, ensuring that Jim is in a position of comfort. I'd thank him, perform hand hygiene, and document my procedure with Jim.